And just one last reminder, we've got someone who's got their microphone off on the phone line, so if you could please mute your microphone at this time, the governor will begin shortly.
Excuse me. Good evening. Thank you all for being here and joining us. Those of you that are watching us being live streamed or on the TV or what have you. Thanks for having us, joining us this afternoon. I want to direct you as we begin this presentation to the Nevada Health Response website. That is nvhealthresponse.nv.gov. nvhealthresponse.nv.gov. There you can find a copy of the daily situation report. I will be referencing some of those numbers on the slides during this presentation, but the daily situation report has a lot more detail that you might find interesting. So once again, it's nvhealthresponse.nv.gov. I know that this is an anxious time for everyone in the state of Nevada. We've been dealt a bad hand here, and the whole country has been dealt a bad hand. I understand how difficult it is to comply with the measures that we have put in place. I don't like it any more than you do, believe me, but I appreciate your assistance. But guided by the medical experts, these were necessary steps to take to protect lives. And here's the good news. The numbers I've been sharing with you show that Nevada has been doing a great job. This slide,
Excuse me, if you're on the phone line, could you please mute your microphone? We're getting some feedback in the room.
Sure, thank you.
This slide is Nevada COVID-19 Community Mobility Report from Google, produced earlier in the week. This data compares to a normal week before COVID-19 crisis began compared to now. What this tells me, and the experts who are advising me, is that Nevada is doing a really great job at staying home for Nevada. It is working. There are other examples out there to reinforce this, but I wanted to show you this one. Nevadans, you are doing it, you're doing a great job, and it is helping, it is saving lives. So by many metrics, we're on the map for being one of the best states at taking social distancing seriously. And no one should be surprised, because when you stay home for Nevada, you do it for your neighbors, your family, and your community. But because you have all done such a good job, I know many are asking, when can Nevada open back up for business? No one wants to get back to business more than I do. We are a proud state. We are a hard-working state. Nevadans take pride in bringing home a paycheck, paying for their kids to be the first in their family to go to college, having a job that provides health care for their loved ones. We're a state that works hard to earn the dollars that we make. We like showing up to work every day. I mentioned the other day that my dad lost his job when I was younger. I said our lives were never the same. When I say that, I mean that I get your anxieties, your sleepless nights, the pressures that are weighing down on all of you. I take this seriously, very seriously. And I know you do too. And it shows in these numbers, it shows in the results you're beginning to produce. As your governor, I can assure you that we're working on the strongest plan possible to reopen our businesses and our communities, one that will focus on putting the health and safety of Nevadans first and sets us up for a strong economic recovery. Never in our history has Nevada and other states faced complete closures of this magnitude. So our reopening plan has to be thoughtfully constructed and well vetted. This plan is being developed based on modeling and projections, health risk assessments, review of testing capacity, and more. It's not as easy as flipping a switch, but I'm confident that Nevadans working with me on this and their commitment to getting this right. This has never been done before. We're working our way through it, and we need your help to work our way through it. If we reopen and we're not ready with the best plan possible, all the incredible work that you've done, all the hard work that you've done to this point will be wasted, and we will run the risk of hurting the economy even more. As soon as we finalize our state-specific approach to gradually getting back to our normal lives, I will be right here telling you exactly how we're going to do it. I have been honest with the public all along, and that is not going to change now. Next week, I'll be here again giving you an update on some of the modeling and projections we've been reviewing and what they mean for our state, in addition to some criteria and metrics that will have to be in place before our phased-in approach begins. So next week, we'll be able to provide you with more detail as it relates to our modeling, metrics, and criteria that are going to be necessary to be accomplished before we move forward. This is worth getting right. And there are a number of factors experts are advising me on to define what that timeline looks like. Now, I'm going to have Dr. Mark Pandori from Nevada State Public Health Laboratory give an update on our testing situation. Dr. Pandori has served as a chief or director of public health laboratories since 2005, including serving as a director of public health laboratories for San Francisco and also in Alameda County, California. He holds a PhD in biomedical science with an emphasis in virology, and he is board certified as a high complexity laboratory director through the American Association of Bioanalysis. He joined the Nevada State Public Health Laboratory about 6 months ago and has already shown himself to be a tremendous asset to our state. And that's great news because we know that increasing our COVID-19 testing volume is one of our immediate and long-term goals, and doing so is challenging, as has been demonstrated by my colleagues across the country. There is a number of reasons why, including a scarcity of available resources due to the competing demand domestically and worldwide. We've had issues getting access to collection and testing kits. These are the swabs that medical professionals use to collect a sample from patients who are exhibiting symptoms of COVID. As you can imagine, those swabs have become very hard to find. But Dr. Pandori's lab has come up with some groundbreaking solutions when it comes to the collection kits. So I'll let him go into detail on that soon. And I have to add that just yesterday, I was on an all-governors call. And Nevada is so far ahead of the game when it comes to innovation because of all the work Dr. Pandori and leaders across the state are doing. Today, I was on an all-governors call with the president. And I don't want to call out some of my colleagues who had no idea you could manufacture the swabs that Dr. Pandori has been manufacturing for over a month. He has been on the cutting edge of this, and he's going to be able to show you the swabs, the testing kit, and exactly how the procedure is done. So before I introduce Dr. Pandori, I want to quickly address a topic that has come up recently, and that is the issue of racial equity or inequity when it comes to COVID-19, another issue faced by states across the nation. From the limited data we have so far at the state level on the demographics of those tested for COVID-19, we know Nevada's populations facing socioeconomic disadvantages, including Hispanics, Black, African Americans, and tribal communities, are not being tested for COVID-19 at the same rate as other populations. For me, that is a big problem, and we will have to work to correct that problem. So when the federal government sent us the rapid test called the Abbott testing machines to governors across the nation, I immediately made my decision to send those testing kits to local health authorities in Clark County, Washoe County, Carson City, Winnemucca, and Elko. These rapid tests can go into populations who previously may not have had access to testing. These tests will be administered in partnership with the federally qualified health centers in those areas, who can also provide other healthcare services for the individuals tested if necessary. This doesn't solve the inequality that we have in our healthcare system. not just testing, our entire healthcare system. We have a lot of work to do here. This is a priority for my Department of Health and Human Services. This is a priority for my administration, and this is a priority for me. Because this virus doesn't care about your socioeconomic status. It's going to spread. So when we make sure there is access for everyone, we are all going to do better. This isn't going to fix everything, but there's just a start to make sure these guests get to people who need it most. I'm now going to turn the presentation over to Dr. Mark Pandori. I want to let you know that Dr. Pandori has been nominated more than once as Nevada Hero of the Day. And while he may not want the recognition, the state of Nevada owes him and his team a debt of gratitude for his work, an enormous debt of gratitude. This gentleman has put us on the leading edge when it comes to testing, understanding, the development, the creation, and you're going to learn a lot listening to him today. I'm glad to have Dr. Pandori here as an expert to help further explain what we have done with testing, what challenges we're facing as a state, and how we're going to solve those problems. So, thank you, Dr. Pandori, for joining us, and I'll turn it over to you.
Thank you, Governor, for this opportunity to talk about this topic, and thank you for the strong leadership that you've been providing to Nevada throughout this. I'm grateful for the opportunity to talk about this topic because testing, along with social distancing, might be the most important weapon that we've got in this pandemic, or armor, if you like. Testing is the medical route to helping the people infected with this disease, but it also plays a critical public health role. So not only are we using testing to find out who's sick so that we can care better for those people, but it's providing us the intelligence, the valuable intelligence we need in this war. And it will get more important, as I'll talk about in a few slides, even as we're trying to get out of this on the other side of flattening the curve. Considering how testing important is, I wanted to use at least a part of my time to educate or to inform the public here in Nevada about the details of testing, and I wanted to go into a more detailed degree than you might see normally on television. It would help understand the complexities and the challenges that we face with testing, but also to understand what Nevada is doing specifically to work through those challenges. The first slide here shows that there are multiple steps that go into testing. When you hear on the news or CNN, you hear test kit or testing, this will help you appreciate that there's a complexity to the testing and multiple steps. I often use the analogy of baking a brownie. Making a lab test is a little bit like making a baked product. You need an oven and you need a pan and you need 3 or 4 or 5 different ingredients. So keeping all of those things functioning and in balance is what one needs to get a proper lab test performed. This slide shows the steps of lab testing. The first step, and the one that you might see in some of the footage on television, or if some of you may have even had if you've encountered testing, is the collection of the specimen. In that case, a swab is put up the nose and goes pretty far up there and back if it's a nasopharyngeal swab that you're getting. And that's performed so that the virus, which is in that area of the body, will get on the swab so that we can perform a lab test. That is performed with a collection kit, and I have an example of one right here. This swab would go in the nose, or in some cases early on in testing, it would go in the throat. It would then go into this material, which we call a transport tube. It's got a material in there that stabilizes the specimen, and this specimen then would travel to the laboratory. At the laboratory, we take this specimen here and that fluid that's in there, and if the virus is present, we do no matter what it is, we do an extraction on that specimen. And if there's a virus in there, what's happening is that the virus's chromosomes are being removed. That moves on to the last step of testing. The reason we're testing for the viral chromosome is it's a very, very specific part of the virus. Just like we have a genome that distinguishes us from our pet dog or our pet lizard or any other animal, this virus also has a genome, and it's very specific to this virus. For that reason, we run a lab test that can look at the most specific part of the virus. The next slide. Now, everybody that's paid attention to the news and has heard about testing has probably heard the first thing about testing that they hear is that there have been challenges to getting tests or test components. And yes, it's true, when the CDC first made this test, and before I talk about those challenges, I actually want to extend appreciation to the CDC because they had this test up and running within weeks of having this agent characterized. But nonetheless, when those CDC distributed those tests to state and public health, local public health labs, there was a problem at first with the test. Nevada was one of the first 6 states to get that test up and running. Several of the states that had more serious problems with it were able to resolve those within about 10 days. But the problems didn't necessarily stop there with testing. Because we were all running the same test across the states, what was happening was that supply lines were extremely challenged for reagents. Reagents is the word that lab people use to call the chemicals that we use to perform this test. The major problem at first in the laboratory was in that step that I talked so much about, taking the chromosome out of the specimen, and we call that extraction. What was happening was that the FDA was clearing the products that we could use to perform testing one at a time. And you might have heard on the news a lot of talk about ventilators and how states were competing with one another for ventilators. But while that was going on, states are also competing with one another for reagents to perform extraction. The FDA was doing its best. It was trying to make sure that quality components were being released so that we were running quality tests. But as those products were being approved, we were all buying the same products, and those products were about as available as toilet paper is now on the shelves. So there's long waits for those products, and we started to hear about public health labs having to slow or decrease testing. But here in the public health lab in Nevada, we were aware that there were at least 20 products that could be used to perform this function. We knew that those products were available, and many of them had extremely high quality. But we would have had to wait in line for the FDA to approve them. So one of the first things we did in Nevada was to take advantage of an offer that the FDA made for regulatory relief. And they said, if your state wants to take responsibility for determining the quality of tests and test components, you can design a system to do that and notify us. Within 5 days, the Department of Public and Behavioral Health for the state of Nevada and the Nevada State Public Health Lab took advantage of that offer, and we created a system where we could use the scientific method to determine the quality of tests and test components on our own. And what that allowed us to do at the Nevada State Public Health Lab and at the Southern Nevada Public Health Lab is to start to evaluate the quality of many different components. And that helped us to alleviate supply problems for those lab-based components. Like a game of whack-a-mole then, of course, the next problem arose, and that was collection kits. And I showed you an example of that collection kit earlier. These are now not in supply anywhere in the country. And we had foreseen that this was going to be a problem when we started to have a lot of problems ordering them at the Nevada State Public Health Lab several weeks ago. But we knew that this was something that we could build. Our lab not only runs tests, but we also construct various tools that we need to perform lab tests. So I knew we had the infrastructure to build these kits. So about 5 weeks ago, we started to construct these kits. And a kit, like I said, is a swab and a transport tube, and the fluid inside the transport tube. We were starting to develop these, but then, of course, yet again, we started to find that there was yet another supply problem, and it was for these swabs. And right now, we are addressing even that problem. The University of Nevada, Reno School of Medicine, which is where the Nevada State Public Health Lab resides, is now 3D printing those swabs. Of course, we're going to do everything we can to determine the quality of those swabs before they go into use. But as we're speaking right now, we are manufacturing the swabs themselves. This is creating very realistically an excess of these collection kits, and so that we're able to provide them all over the state of Nevada so that testing can continue. You're going to hear more, I think, about other laboratories doing this. We were the first to get this going. So having gone through and moved over these hurdles, we now have a capacity and have had a capacity to test in Nevada since February 11th. At any given moment, the State Public Health Lab maintains the ability to run at least 5,000 of these tests. That's not to say that we only have a 10 or 11-day supply of testing. That's a minimum that we're keeping on hand right now. Because of the solutions that I talked about on the other slide, here in Nevada, we're able to stay in the testing business in perpetuity, as far as we can see right now. And at the State Public Health Lab here up in Reno, we serve the entire state of Nevada. I wanted to emphasize and be able to say, remind all of you that we have 35 staff there, and while we're doing COVID-19 testing, the State Public Health Lab has not stopped doing the other functions that the State Public Health Lab has always done. And that includes testing water for its safety, so that water doesn't contain toxins or bacteria that are harmful, and we continue to do newborn screening. Every baby born in Nevada is still getting a newborn screening test at the Public Health Lab, even along with all of the COVID-19 testing that we're talking about here today. Our lab is one piece to the puzzle in testing in Nevada. There are other partners. Private labs are doing a large amount of testing, as well as hospitals and the Southern Nevada Public Health Lab as well. All of us together are contributing to the testing that's going on in Nevada. But I don't want to imply that this is enough. We have testing function, but if we want to move forward, we're going to need to do more, and nobody is misunderstanding that at the State Public Health Lab. The road ahead with testing looks like this. Remember when I opened, I talked about two functions that lab testing had. Testing performs a medical function, and we might say that's the most important thing, ascertaining whether someone is ill so that we can care for them. But the other important, and we're doing a very good job of that with the amount of testing that we have in Nevada right now. But if we want to come out of this and that slide down the other half of this curve, you might think, well, gee, testing might become less important. It becomes more important. And so we have to press on the gas pedal and get even more testing done, because we have to now address what I talked about earlier, the public health function of testing. This is about gathering intelligence. This is about finding out where the enemy is, how much of it, and finding out that number for two reasons. How much risk is there out there as we start to come out of this and try to re-enter normalcy? But also to ask, hey, when the smoke clears, how many people were infected and are infected? Because we still don't know that denominator. When you look at those test numbers on the news, that's people that have been tested largely because they're symptomatic. We still, in this country, don't have a handle on how many people were truly infected. And in order for us to really understand this infection in terms of its fatality and how we're going to come out of this, we need all of that intelligence. So how are we going to accomplish more testing? We have a plan. There's a lot more testing to come. In the labs that currently test, we have automated devices that will be coming online. It won't be 24 or 48 hours from now, but in the coming weeks, we have the equipment in place in the public health labs and in the larger private labs where high throughput testing will become a reality, and we'll see large increases in the amount of testing that will be performed. Many of the hospitals that currently aren't testing are bringing on testing. It might not be super high throughput testing, but it'll be testing that allows them to manage the population of their patients, and we'll see more and more of that. And the governor spoke to you about an Abbott test, which we call in our business a point-of-care test. Those are being distributed, and when they start ramping up, what will happen is the public health labs will be able to concentrate more on the public health and intelligence gathering testing rather than the medical side of testing. And then lastly, another weapon coming, antibody testing, sometimes called serology. You're hearing a lot about that, and I know it's an extremely popular topic. The tests are a reality, and they're on their way. But I wanted to use the last few seconds to remind people what these tests can and can't do. These are blood tests, so the swab that I showed you earlier isn't what's going to be taken. In this case, blood is taken. And what we're trying to determine with this test is, does your body make antibodies to this virus? What that says is, were you exposed or infected with this virus at some point? It may not do a very, very good job of saying whether you're presently infected for a number of technical reasons, but as we're coming out of this and as the smoke is clearing, it'll help public health immensely understand who really was infected with this virus, because we still don't know. There's questions about whether or not a reactive result on a test like that will inform us as to whether you're immune to future infection. And we'll say we're gathering the data on that, and we may have answers for that in the coming future, because that's a very important question as we come out of this. But right now, nobody's taking a time out on this. It's just a matter of gathering the right data so that we make the best and informed decisions based on that data. Thank you for the opportunity.
Thank you, Dr. Pandori. I sincerely appreciate your explanation, you sharing your knowledge and experience with us, and I think that people are going to learn a lot from that. Before I go on to the Nevadan hero of the day and some questions, I've asked my staff to compile, as we did last time, a few of the most commonly asked questions that we have from phone calls that we're getting in our offices as it relates to testing, and I'm sure they're questions that most of the media partners have had as well. So I'm going to ask those questions of Dr. Pandori, and then we'll wrap it up and take some questions from you. First one, Dr. Pandori, how do I know if I need a test for COVID-19? Where can I get one, and who am I supposed to call?
COVID-19 has symptoms, and we may have heard quite a bit about them. You can go to websites such as the CDC or the health district websites to find out what those symptoms are. But primarily, if you have a fever accompanying with a cough or a shortness of breath, then you should consult your healthcare provider immediately and do what your healthcare provider advises. A reminder that in Nevada, laboratory tests are ordered only by healthcare providers and by health districts. So if you think you need a test and you really think you're unwell with a fever and a cough or a fever and a shortness of breath, your healthcare provider will see to it that testing is provided to you here in Nevada. The testing would very likely be done at a public health lab, but if it's a hospital that you're at an emergency department, certain hospitals are providing testing.
Great, thank you. A second question, if someone in my house tests positive for COVID-19, do I need to be tested, and what should I do?
If you know that you've been in close contact with somebody who's confirmed positive for COVID-19, the very first thing you should do is to consult your healthcare provider. Your healthcare provider is going to ascertain your symptoms, if you have any, and determine whether or not you need a laboratory test. It's very likely that what you'll be asked to do is to self-quarantine and to monitor your symptoms. If any of the symptoms that I talked about earlier arise, contact your healthcare provider to get a laboratory test.
Thank you. And the last question, if I test negative, what does that mean? And does that mean that I'm in the clear?
The laboratory test that I described in detail, the swab test, so to speak, detects the virus itself. So what that test is telling us when it's run is whether or not we can find the virus in you at that time. What that test doesn't, if you're negative for that test, it doesn't mean that you couldn't become positive afterwards. It just means that in that moment, you currently are not infected with the virus. For the antibody test, we still have to work out what that means because we're still studying what the power of those tests can be.
Thank you. Thank you again, Dr. Pandori, for joining us this afternoon. I'm sure there's going to be more questions from some of our media members soon, but first, I want to highlight our Nevadan hero of the day. Autumn Harry, a member of the Paiute Lake Paiute tribe and a graduate student at the University of Nevada, Reno, has addressed a huge need for her Native American community in northern Nevada by using her fishing skills to help put ancestral foods on the table for elders of the tribe. You can see some of the fish she's got up there on the picture. She's also launched an effort to encourage other natives to take an oath to implement safety protocols with families and communities and how to be responsible relative to our most vulnerable populations. Thank you, Autumn, for all that you're doing for looking out for our state's tribal members. Again, if any of you know of a fellow Nevadan to nominate, please email nevadahero@gmail.com. Congratulations to Autumn. Now Dr. Pandori and I will take some questions from the media.
If you're on the phone line, if you could just keep your phone on mute, and we'll call you in a second. We're going to take a question from the room in Carson City first. Thank you.
Nice to see you, Governor. Wanted to ask about reopening and specifically in how it relates to the topic at hand today, the testing. Is there a level of testing that will inform that decision that you have already kind of benchmarked? And I'd like to follow up.
Okay, well, I don't have a benchmark date yet. I mean, I'm looking to the statistical analysis that's coming forward on a regular basis. I consult with experts like Dr. Pandori, like our medical advising team, to come up with various analysis. I'm looking at some of the data that's provided me. For example, the hospital intensive care admissions, the usage of beds, the beds that are left available, our rolling average of positive tests that we're taking, those sort of things to kind of determine when we've hit a plateau and we start to move down. So those are the things that I use.
And you haven't seen that, anything,
I haven't seen enough to give you a specific date,
okay.
but we analyze this on a daily basis.
Okay, and then if you could you just kind of respond to some of the comments that we've seen from the mayor of Las Vegas and the Senate Majority Leader about urging kind of a more concrete timetable?
I'll answer the question, but I've got the preeminent person, one of the preeminent people in the country here to talk about testing, so I hope we can get to those questions. I heard some of the comments. I'm not going to respond to those comments or attacks that are made on me or my decisions. I can tell you that I spend 24 hours a day. My wife can tell you I don't sleep well anymore, analyzing these decisions. I know it's tough to stay home. I understand that, but it's tough for it to have Nevadans die on your watch. I fully understand that, and those are the instances I have to weigh, and I'm putting the lives of my fellow Nevadans ahead of any dollars, and we will open when the time is right. When the experts tell me and the data tells me that it's okay to open, then we're going to do it, and we're going to do it in a manner that's safe, and we'll get to where we need to get to. But for right now, I'm analyzing data. I'm relying on people that are an awful lot smarter than me, like Dr. Pandori, to give me the information that I need, and I will put the safety of our folks ahead of any profit. And people that think you can just say we're going to open back up and suddenly these hotels are going to be filled don't understand how the hotel industry works. So I've also had conversations with our business and community leaders as it relates to that. Thanks, Bill.
Okay, we'll go to James from the RGJ on the line. James, if you're on the phone, could you unmute your microphone and ask your question of the governor? Thanks.
Hi, Governor. I hope I didn't misunderstand you earlier when you were talking about a plan, or you made it sound like someone was working on a plan to potentially reopen the economy. Did I understand that correctly? Who's working on it, and can you give us the broad outlines of what you've established so far?
Well, Ava, as I've discussed, I don't know what specifically you're referring to, James, but I can tell you I'm looking at the data that is provided me by our medical experts, by our scientists. I'm also studying availability as it comes to our hospital surges and what might be available there if we do have a setback and we need to go up. I'm dealing with our mental health professionals as it relates to people that can provide me with information, and how the plan would be orchestrated, I've said all along, would be in a very gradual manner, that restrictions would slowly be released or relieved a little bit. It's not going to be just flip on the light switch and everything goes back to normal, because that's not how we're doing things. We're going to start slowly. We're going to see how that goes after a period of time, and then add a little bit more, release a little bit more regulations, and go forward. But I do not know when that time is going to be, and it would be unfair to me for me to just guess out a date. I won't do that.
Thank you, James.
Sure.
We're going to go to a question in the room now. Thank you.
Governor, some of the rural counties, specifically White Pine County, have said they want to ask you that they would be exempt from any future shutdowns past the existing one you have in place. Are you going to allow counties to exempt themselves, or geographical regions? Okay,
as governor of the state of Nevada, I'm responsible for 17 counties. They have the responsibility of White Pine County. That's who they're elected to serve. I'm elected by all the citizens in the state of Nevada, and I will take the action that I feel is most appropriate for the state of Nevada. The idea of relieving one as opposed to another, and then it becomes a hot spot, just because they're smaller counties doesn't mean that they don't have an issue there. Humboldt County is one that we've had a significant number of positives. You've seen that in Elko. I haven't had my team analyze everything that's in White Pine County. We will look at every county as we move forward, but I don't know if there will be restrictions county by county.
When you describe a gradual reopening, are you referring to geographical regions or industries? What are you referring to?
I'm more referring to industries than I am to geographical areas, but we can look at geographical areas if there's areas of the state that have had no issues, but it will not be just everything back to normal even in those areas.
Thanks, Michelle. We're going to go back to the folks who are on the phone. Joe Bartels from KTNV. If you're on the line, could you please unmute yourself and ask your question?
Thank you, Governor, for taking my question. My
question is about the external pressure that we've seen in other states. Michigan, for example, there's been protests of people that want to have their industries and government reopened, and we're hearing that there might be some protests as early as this weekend regarding the opening up of certain industries and the government. And we've also heard from Mayor Carolyn Goodman talking about she's been very critical of the closure order and has been kind of wanting things reopened. What do you say to those folks?
Okay, well, I'll go one more time to Mayor Goodman. I've told you, I don't know who she's relying on for her experts, because none of my experts have given me anywhere near that information. I rely on the experts that I have. I've got one of them here with you today. And I'm confident that they're providing with accurate information as it relates to the protests. I mean, we had one up here last week, I had one, and I'm a firm believer in our Constitution, everybody's right to protest, and if they choose to protest, I just ask them to please exercise social distancing when they do their protests and keep us safe.
Thank you, Joe. We'll go to another question in the room here in Carson City now. Thank you.
Thank you, Governor. This question is for Dr. Pandori. These automated devices, these machines for high volume testing, will this open up the protocol for who and who does not get tested in Nevada?
Actually, when high throughput testing is available, more widely available in private and public health labs, it takes that question sort of out of the equation because it becomes possible to test and both symptomatic and asymptomatic people. And put it another way, we wouldn't have to be as choosy if we had a high throughput, a high bandwidth for testing.
Thank you.
Yep.
Thank you. We'll go back to the phone lines. John Sadler from the Las Vegas Sun, if you're on the line, could you please unmute yourself and ask your question?
Hi, Governor. Thanks for talking with us. I just wanted to see the Democrats, both state and the DNC, have filed a lawsuit hoping for changes to the mail-in primary in June proposed by Secretary of State Zagafsky. Do you think that there should be any changes made to that process?
Well, you know, I have not read the lawsuit as of yet. I've seen some of the comments on social media as it relates to the lawsuit and some of the articles that'll be written. I'm sure I'll be able to have my counsel give me a copy of the lawsuit to give me some late night reading tonight or early morning reading tomorrow to look at. I can tell you this, that I was born and raised in Milwaukee, and what happened in Milwaukee, Wisconsin was atrocious, that people were standing in long lines, you know, not social distancing. That's something that I certainly could not tolerate in Nevada. I believe that everyone has a right to vote. I know the Secretary of State put a lot of time in on this in consultation with the various registrars in the 17 counties, and we'll have to wait and see, but I have not weighed in on the lawsuit and haven't read it yet.
Thank you, John. We'll go back to questions in the room.
You said that the minorities were not being tested at the same rate as other states. Do you know if they're coming down with a greater rate of the disease when compared to other populations?
I can only give you anecdotal stories. It certainly has been the case across the country that they are coming, not that there's a propensity or they're more susceptible to the disease, just that the healthcare system and the socioeconomic system that they live under makes it more, I guess, likely that they could contract the disease or be infected. So it's something that we need to look at and see how it is impacting our minority communities. The same is true for our convalescent care facilities.
Thank you, and we'll go back to the phone line. Jacqueline Schultz, Fox 5, if you could unmute your microphone and ask the governor your question.
Thank you, Governor. Mayor Carolyn Goodman, as we mentioned, had sat down with numerous media outlets today. One of her reasons for why she believes the shutdown should end is because people right now have no way to put food on a table and people will be hungry and homeless. What's your solution and what's your words to the people of Nevada, how they can be protected economically while there is no work?
Okay, I cannot end the shutdown until I feel confident that we are in a good position as it relates to the spread of the virus, the hospitalization. Some people are more concerned with the business side of this and than the human toll that this virus is taking. The human toll is the most important to me. I am listening, and I will repeat this as many times as you'd like me to medical experts, to my scientific experts, and determining what is in the best interest of this community. I do not know who her experts are. You can see one of my experts here. You know who my experts are on my medical advisory team. It's all been made public, it's all posted. And I will stack up my medical experts against anybody else that's putting together a team that's gonna decide when we should open. I was elected to represent all the citizens, all the folks in the state of Nevada, and that's what I intend to do.
Thank you, Jacqueline. We'll go back to questions in the room here in Carson City.
Governor, yesterday a new call center came up and added potentially 100 new people to take calls. We've heard all along that that wasn't going to be resolving individual claims, and that seems to be the case. Do you have any evidence this is actually helping the situation?
Well, it's premature to say whether it is or it isn't. It's so early on that. I have read some of the media comments on that. I'm hopeful that it will. I mean, we've got a reduced number of password resets, which is clearly a positive for us. I think we're getting to people quicker. My staff, working with Dieter, continues to explore every option we have available to hook people up with their benefits, and we'll continue to do that. It's a big priority for me.
Do you have any solution for people that are forced to find a fax machine to get their documentation into Dieter?
Well, you probably don't know what a fax machine is. In my era, everybody had a fax machine. It's just the way it is. I mean, it's unfortunate. I don't have all the answers. I wish I did. And people, I understand people are frustrated. They're impatient. And I don't mean that in a negative way, but they're frustrated and they want action. They want action now. I've got a team in the state here that is working so hard. Nobody has ever faced anything of this magnitude. And it's easy to sit back and criticize. And it's easy to throw stones. And it's easy to say that do this or do that. I will stand up for the group that I've got working for the state of Nevada, for the people that serve our state, as my staff, as our employees, as our team members, and I'll put them up against anybody. And if they want to continue to keep criticize me, don't criticize them.
Thank you, Michelle. We'll go back to questions on the phone line. Sasha from 8 News Now, if you're on the line, if you could unmute yourself and ask your question. Thank you.
And it wasn't you doing the criticizing, Michelle. I wasn't criticizing you, criticizing us in general.
Okay.
Sasha, you there?
I'm not hearing Sasha, so we're going to go to Siobhan McAndrew from the RGJ.
Thank you so much. How much more testing, Governor and Dr. Pandori, do you think we need? Exactly how much more testing? You said more is coming on. For both of you to be able to sleep at night, I know you're talking about the loss of lives and all of that. How much more testing should we have in Nevada? And how much has Dr. Pandori and other people in Nevada been able to procure some of the tests versus what we've gotten from the federal government?
Go ahead, Doctor.
I couldn't hear the second
How much more
one.
testing do you think we need? What can we do to procure more testing? I think that was kind of summed it up.
Yeah.
And how much more have we procured here ourselves in Nevada versus what we've received from the federal government?
How much have we procured from the federal government testing, and how much are you getting on your own?
Thank you. With regard to how much testing we need, I think the governor was addressing that earlier, and I agree 100%. We're not going to put an exact number, a magic number on how many tests we need to determine whether or not the coast is clear, so to speak. We know we need more testing, and we're getting more testing. Now, with regard to how much we've been getting from the federal government versus how much we've developed here ourselves, I want to go back to the analogy that I made when I was talking about testing, comparing it to baked products, because it's actually a really good analogy. You need a pan, you need an oven, and you need eggs, and you need brownie mix. The federal government continues to provide a very adequate amount of brownie mix, which would be the material we use to detect chromosomes, what we call in the trade the primers and the probes. We're getting those from the CDC, and they're doing a fabulous job of providing them. Other things the federal government is not providing us would be extraction kits, and we've been able to obtain over 10,000 extraction kits from private sources. And now working with DEM and the National Guard, we're able to get those with great alacrity and ease. So it's been a balance. We've been getting a lot of things on our own here in Nevada to keep the engine of testing running, around 10,000 extraction kits. But the other part of the brownie mix or the testing, we still continue to get that from the federal government, and that's been really helpful that the CDC has been able to provide that. The collection kits, we've made well over, I would say, 4,000 of those, if not maybe over 5,000 of those now. And we're going to continue manufacturing those unless and until there's suddenly a lot more available, but we know that those aren't going to become available for quite some time.
If I could add just a little bit to that, there's two reasons for the testing. The first is you need the testing for people that are symptomatic so that we can determine if in fact they have COVID-19 or they don't. That is what we are using the testing for today. Now, some of the outlets do a great job, and you've got graphs on your sites and whatnot. I know the Indy's got a great one up with their charts and whatnot. We use some tests for that, for the symptomatic individuals. I need to be able to test the percentage sample of our population that are asymptomatic to see if I could test 1% of our population and determine at random and determine what percentage of those people are infected, then we could extrapolate out in terms of our entire state what the propensity of the virus to have spread into our general population is. And that's where Dr. Pandori has been invaluable in terms of helping us to be able to expand that into more groups and get some of the healthier people that don't necessarily show symptoms.
We can take one more in the room.
Thanks. Going back to what possible directives might still be in play here, are you satisfied at this point with how people are adhering on the business closures, on other some of the directives that you've put forward? And specifically, I'm wondering if you're thinking about anything in terms of food service workers and whether they should be wearing masks or anything along those lines.
Well, there's a couple questions there. The vast majority of Nevadans, as from the chart, are doing a great job following the directives. I mean, they're staying home for Nevada, they're wearing a facial covering, they're not gathering in groups of 10 or more, they're social distancing, their activities are something that they think about before they do and that they're in good interest. There are a few people that think that they are impenetrable, that they will not contract the virus and don't have a concern about spreading it to a family member or loved one. And I guess it doesn't matter how many restrictions I put into place, they're not gonna listen to me. The vast majority are carrying the weight for everybody else. As it relates to masks for healthcare workers, or for restaurant workers, I would suggest that people wear a facial covering. I ask them not to wear an N95 when we're still short of N95s. I've got calls to send them into some of our nursing homes and some of our rural communities that, you know, they need more masks and more gloves and more PPE. But I think a face covering is something that's good, beneficial.
Thank you. That's all we've got.
Good.
We're good.
Go ahead. Come
Governor,
on, Megan.
Next week will be 1 week out from the end of your shutdown directive. Are we going to know at this press conference a week from now whether that's going to be over yet or extended?
I don't know if we're going to be able to know exactly if it's over. We'll be able to give you more guidance in that direction. If I felt comfortable giving a guidance one way or the other today, I would give it to you. I am looking at data, and I mean on a daily basis. We have got some really smart people. I mean, I deal with all kinds of different issues, but I've got experts that deal just with this that I talk to, and they explain to me what happens if and I'll say, what happens if I allow this to open or that open, and they'll show me on a graph what could potentially happen. I cannot take the chance of overwhelming our healthcare system and not having a way back out of it. So it's going to have to be a gradual step. They will advise me if they think, based on the statistics that we have and the data that we've collected, if it's a time to start loosening the grip a little bit and opening up the faucet. And then we'll see how it works after a little while. If we don't have an enormous spike in positives or an emergency room usage or whatnot, they'll be able to give me that information as we move forward. It's not going to be just flip it on and the city's back open and the state's back open for business. It doesn't work like that. It's just not realistic. So I ask everybody to be patient with me. We will know a lot more next week in terms of how we're going to do in terms of extending or not extending various directives.
You think we'd have at least a week's notice before schools had to completely come back into session?
We will give as much notice as is humanly possible, and I think that that's a reasonable amount of time. Same as, I'm not going to say you can open up in 24 hours. People need to be able to make plans, and we will provide the information. As soon as I get it, I promise you, we'll pass it on. Okay, thanks a lot. Thanks for coming, everybody.